Hello, I am Dr. Chirag Thakkar, and today I am going to talk about bariatric surgery, particularly the laparoscopic gastric bypass surgery. If you are thinking of bariatric surgery, I am here to give you answers to so many of your questions. If your BMI, that is the body mass index, is more than 32.5, or say you are extremely fat, it may harm you in more ways than you can think of. It is bad for your health, and some of you would have already experienced that. It can lead to diabetes, high blood pressure, high cholesterol, breathing problems, sleep apnea, varicose veins, knee problems, infertility, and much more. It has been proven that extreme obesity decreases your life expectancy. Also, for extremely obese persons, losing weight and maintaining it with just diet and exercise is almost impossible. With the problems like lungs and heart problems and knee pain, exercise or even brisk walking may not be possible. Bariatric surgery helps you go back to your normal health by decreasing your weight, and then you can follow your routine exercise schedule. All this is possible by making changes in the anatomy of your gastrointestinal tract by a laparoscopic surgery. You should understand that it is not a cosmetic surgery like a liposuction or a tummy tuck, but it is a disease-modifying metabolic surgery aiming at improving your health and your quality of life. Today we will talk about the normal process of digestion, how weight loss occurs after a laparoscopic gastric bypass surgery, the outcomes and risks related to this surgery.
An average human stomach can expand to hold about 1.2 to 1.5 liters of food, about the size of a small watermelon. Once in your stomach, the food combines with digestive juices containing acids and enzymes that help break it down into smaller particles and more simpler form so that it can be more easily digested and absorbed when it is in the small intestine. Once broken down, the small particles are slowly released into the first part of the small intestine, the duodenum, via a ring of muscle called pylorus. Bile and pancreatic fluid from the liver and pancreas mix with the food in the duodenum and allow the food to be completely digested in the intestine. Most of the nutrients from the broken down food are absorbed in duodenum and jejunum, that is the first and second part of the small intestine respectively. The nutrients that are not absorbed in the small intestine are removed from the body as waste. Gastric bypass surgery is a combination of restrictive and malabsorptive procedure. That is, this surgery reduces your food intake and also decreases the absorption of calories from the consumed food. During gastric bypass surgery, a small stomach pouch is created at the upper end of the stomach by using a stapling device, and the remaining stomach is completely separated from the newly formed pouch. This pouch will typically hold about 35 to 50 ml of food. The small intestine is then divided into two sections. The lower portion of the divided small intestine is then connected to the newly created stomach pouch. This connection is called anastomosis or the bypass joint. The upper portion of the divided small intestine is then reconnected to the lower portion of the small intestine by a second bypass joint. We may use traditional stitches, staplers, or combination of both to seal the divided portion of the stomach and intestines. This seal is called the suture line or the staple line. This surgery allows food to pass directly into the lower small intestine, bypassing the majority of stomach, duodenum, and a portion of jejunum. However, the digestive juices from the large portion of your stomach, liver, and pancreas will still travel through the duodenum and will meet up with the food at the second bypass joint. These acids and juices will aid in digestion as the food travels to the remainder of the small intestine. Weight loss after surgery will happen due to multiple reasons. First, the small stomach pouch restricts the amount of food you can eat before feeling full. Secondly, once the food leaves your stomach pouch, it will bypass your duodenum and part of your jejunum. This means less calories will be absorbed by the body. By altering the anatomy of your gastrointestinal tract, gastric bypass changes signals in the body, resulting in decreased hunger and increased feeling of fullness after a small meal. Thus, the decreased caloric intake as well as the decreased absorption will lead to the desired weight loss. Also, the food going directly to the lower small intestine results in changes in the hormones secreted by the intestine, leading to improvement in diabetes and cholesterol levels. Gastric bypass surgery has a higher chance of curing your diabetes and other health-related problems compared to a purely restrictive surgery like sleeve gastrectomy. But this benefit comes with a need for strict, lifelong follow-up and long-time vitamins, iron and calcium supplements. It is always important to emphasize that you do require to follow a healthy diet in your routine life. There is no option for that. Most patients lose between 50 to 70% of their excess body weight over a period of 18 months. Excess body weight is the weight above your ideal weight. The maximum weight loss occurs in the first 3 months of surgery, after which the rate of weight loss decreases. This much weight loss is enough to give you all the health benefits of weight loss. Compared to sleeve gastrectomy, gastric bypass surgery has shown more consistent weight loss, which is maintained over longer period of time. Gastric bypass surgery has a tremendous potential of curing many of your medical problems like diabetes, high blood pressure, high cholesterol, knee problems, breathing problems, and varicose veins. Roughly 80 to 85% of patients get cured of all these problems, and the rest of them can see a significant improvement in terms of good control of these problems and decreased medications. Gastric bypass surgery is superior to sleeve gastrectomy surgery in terms of improvement in diabetes, cholesterol, and blood pressure. It also increases the chances of you getting pregnant if you are facing an infertility problem. Carrying a baby to term is safe after weight loss surgery. However, it is recommended that women use birth control and avoid becoming pregnant while they are still losing weight. A year after surgery, most patients are generally happier with their lives. Most patients feel they have taken a right decision to undergo surgery and would suggest surgery to persons with similar condition. Though this looks simple, it is a major surgery and has its own risks. Leak from the staple line, bleeding, and clot formation in your leg veins leading to lung problems are among the dreaded complications of this surgery. It can happen once per every 100 surgeries. Patient having these complications may require another surgery or prolonged hospitalization. Laparoscopic gastric bypass surgery is done under general anesthesia, which will put you to sleep for the duration of the operation.
You are supposed to be fasting for at least 6 hours before the scheduled time of surgery. Though, you need to take your regular heart or blood pressure medications with sips of water if they are routinely scheduled during these 6 hours. As you will be fasting, you need not take your diabetes medications. You should confirm this with your doctor if you have any doubt. If you are on blood thinning medications, you should ask your doctor whether you need to stop them before surgery.
A breathing tube will be placed through your mouth into your throat to help you breathe during the operation. To gain access to the abdomen, we will use sharp instruments called trocars to create 5 to 6 small holes in your tummy called ports. The location of these ports will depend on our preference and your body structure. Carbon dioxide gas is then pumped through one of the ports to puff up your tummy. This helps us to clearly view the contents and also gives us space to complete the surgery. Next, we will insert a laparoscope through one of the ports. A laparoscope is a long thin tube equipped with a light and a camera. Images from its camera are projected on the monitor in the operating room. We will then pass various instruments through other ports. This will be used to carry out the surgery. First, we will divide your stomach with the help of stapling device to make a small pouch of stomach. The small stomach pouch that is attached to the esophagus will only hold about 35 to 50 ml of food. The larger portion of your stomach will be alive and will remain inside your body. It will still produce digestive juices to aid digestion, but it will no longer come in contact of food. Then we will measure the length of small intestine that will be bypassed. This bypassed section of intestine will include all of the duodenum and a part of jejunum and is about 75 to 100 cm from the beginning of small intestine. The length of bypass is determined by your BMI and your overall medical condition. We will then divide the small intestine at this level with a stapling device. The lower portion of the divided small intestine is then connected to the newly created stomach pouch with the help of a stapling device. This new connection is called the anastomosis or the bypass joint. The upper portion of the divided small intestine is reconnected to the lower portion of the small intestine about 75 to 100 cm down the previous bypass joint. We will finally look to check there is no bleeding and place a drain tube through one of the port side holes. A port valve is briefly left open to allow all the carbon dioxide gas to escape from your abdomen. Finally, the keyhole incisions are closed with sutures and covered with bandages. An uncomplicated laparoscopic gastric bypass surgery usually takes about 120 to 150 minutes. After surgery, your breathing tube will be removed and you will be taken to the recovery room for monitoring. You will be given enough pain medications as needed. You will feel a bit sleepy immediately after operation due to the sedative medications given during anesthesia. You should try to move the limbs and sit up soon after surgery. Most patients can walk and go to the toilet in 4 to 5 hours after surgery. There are no restrictions whatsoever for physical movement. In fact, majority of the patients will feel much better after they have started movement. The pain also reduces dramatically once you start sitting up, moving and walking. We strongly recommend you to get out of bed in few hours after surgery. This is very crucial as a part of measures to prevent clot formation in your leg veins and breathing problems. You are allowed liquids orally from the next day morning. In case you vomit, there is nothing to worry about. We will stop giving you liquids and restart it after 30 minutes. Liquids may include water, juice, soup, dal water, or protein supplement in water.
If you are diabetic, you should take liquids allowed by your diabetologist. You can start all your regular heart, blood pressure and diabetes medications once you start taking liquid.
You should remember that your stomach is now very small, so you should take just a sip or two at a time in the initial few days. You should stop as soon as you feel full. After the gastric bypass surgery, we recommend a liquid diet for the first 2 weeks after surgery, and then blenderized or soft food for another 2 weeks. Emphasis should be on consuming food high in protein and vitamins. It is very important to maintain good hydration by drinking about 2 liters of liquid per day. We routinely discharge the patient on 3rd day of surgery. Hospital stay may be prolonged for patients with heart, lung or kidney disease as per their disease status. Patients with severe breathing problems may also require a day of observation in an intensive care unit, that is an ICU. You can take shower from the next day of surgery. Usually there are no stitches to be removed. The drain is removed on day 7 along with wound dressing in the follow-up consultation. You can resume your routine household and office work in a week to 10 days as you feel comfortable. You can drive a car in about a week, can walk as much as you want, and can climb a couple of flights of stairs. In fact, these are the major advantages of laparoscopic surgery. After gastric bypass surgery, we recommend vitamin, iron and calcium supplementation during the first 3 months. Further need for vitamin, iron and calcium will depend upon the vitamin levels checked after 3 months. Most patients will require long-term vitamin and iron supplementation. Most patients do not require protein supplements. After surgery, since you eat less, what you eat is very important. Therefore, you should pay attention to eating healthy, emphasizing on food with high protein and vitamins and with low sugar and fat. However, if you find yourself snacking on junk food, you will surely require protein and vitamin supplements. Regular exercise is an important part of weight loss treatment. It is good to begin exercising as early as you can after surgery. Pace yourself but don't overdo it, especially if you have not been exercising regularly before surgery. Start with light exercise like walking, jogging, aerobics or bicycle riding, and gradually increase to more strenuous activities. Try to find an activity you enjoy so that you can stick to it. Regular long-term follow-up is needed to monitor weight loss, provide dietary counseling, and to monitor the occurrence of nutritional deficiencies or complications. As with all weight loss procedures, behavior modification, dietary compliance, and exercise plays a critical role in the long-term success of the procedure. All surgeries presents risks. Your weight, age, and medical history determines your specific risks. You can come and meet us to know if bariatric surgery is right for you and what surgery to choose.
Hope you have got the answers to your questions. If you have any further question, you can meet me with prior appointment. Feel free to ask any question that may come to your mind. To book an appointment, call 079 2970 3438 or 84693 27634 or log on to www.drchiragthakkar.com or email me at drchiragthakkar1307@gmail.com. Wishing you a happy and a healthier life ahead. Let the inner healthier person come out of yourself.